What's today? May 22nd. So it's a Wednesday. So hopefully this is gonna be a quick in service. Just remember the transfer. There's many ways you can transfer, but you only have one bag. Okay. You break your bag, as I mentioned before. It's gonna hurt, and it's gonna hurt forever. It doesn't go away. There's very poor circulation in your back, and it's likely you're gonna have that back pain for the rest of your life. Okay, so make sure not only you're lowering the bed, or you're lowering the bed, or whatever the platform is, you're getting to a situation where you're lifting your resident, and you're even with your resident, you don't have to bend back. As soon as you start to bend back like this, you're already putting your back at risk. Okay, so we're gonna do the basic in terms of transfer right now. We're gonna look at transfer from bed to chair. Okay, so I'm gonna use this table right here. A lot of your staff right now is scared to be on TV right here, or just like there's like 4 people that's watching this video literally. But like it's helpful because some of us can't make it to in-service. Let's just, for example, this is the bed, which is the table, and you transfer your resident that's laying on here. The head is here. I should have this in-service in the room, but I have some Hoyers and Easy Staff. We're gonna do it here. The resident is laying here. The head is here, and the feet is here. You wanna get that wheelchair close to the bed, right? If you need to, guys, these things right here on the side, these comes off. Right? These comes off, and this can, you can take it off, and now you have access to the wheelchair. You can bring that resident. You can even slide it in there. You can slide that resident, and you can do a transfer board. Okay? Just remember that transfer board. When you do use a transfer board, the bed, the location of the resident has to be higher than their where they're going to. Right? Their end point. Right? Vice versa. If you're trying to transfer from chair to bed, the chair has to be higher than the bed in order for you to get that. What do you call it? That slide, right? Yeah, you want that resident to kind of slide down. Otherwise, the transfer board is really difficult to do. Okay. Once you get that resident on the board, basically you just kind of push him over, right? So it'll help you when the board is kind of slanted over. All right. If you don't have a transfer board and you're just trying to transfer your resident, okay, make sure that this bed is. It's level or slightly a little higher than the chair, because what you want to do is you want to lift the resident up and you want to kind of just drop him into the chair. Not drop him physically, but you want to get him down and over here. If you have to lift him up because it's too high, this bed is too low, then it's not doing you any help, right? What you want to do, I need somebody to come over here. Okay, so now this is, for example, that Raquel is the resident. And then now I have her seated up, right, in this chair, in this bed right here. This is our bed now. Okay, I have the resident, she's seated up now.
Just sit on the edge?
Yeah, just sit on that chair right there. Okay, so Raquel is our resident. What you want to do really is you want to get this position nicely. If you have an assistance, obviously, right, you want to get this a little further away where both of you guys are kind of like right here, getting the resident. Okay, and then the gate belt is going to help you. This is why we say our seniors have to have a gate belt, because you don't want to be grabbing your resident in their pants and ripping their pants, ripping their shirt. Okay, so if you have the gate belt on adequately, right, you can grab onto the resident and grab onto the gate belt. Okay, now you have a nice hold on the resident. They're less likely to have injury falling down. But let's take a look at the actual transfer here. Okay. If you're by yourself and you're able to do the transfer on your own because the resident's light, what you want to do, you want to use that knee right there, right? Obviously, you don't want to pop her knees in. These residents already have a really frail knee, but it's going to help you bring the resident up. So this leg right here, when you bring the resident up,
put their feet flat. Make sure they have shoes on too.
Yeah. Let's go back real quick. Say the seniors have to tell me this because, right? A lot of times.
But some people don't think about it. If you're new.
Yeah, you need a nice footing. Yeah, you're right. You need a nice footing.
Because if they don't, they're like back here to kind of like,
That's the thing too, guys. When you're not positioned, when you don't have the bed positioned correctly, the resident's gonna be uneven. Yeah. So keep the bed nice and flat, right? And it's gonna be slightly higher than the chair where you're going into.
Push off.
Okay. Yeah. So what you want to do, what physical therapy has really taught me over the years when I do transfer, is that you can use this knee as a stabilizer, right?
I know.
you do this right here. When you do a transfer right here, you can push this knee up, right? And this right here is gonna help you keep that resident in place, right? So put your hands over this. When you go like this, when you bring the resident up like this, you wanna push that knee up, right? And then this leg right here is gonna stabilize that resident. You don't wanna do this with resident that's like 10 times bigger than you. Okay, you're not likely to do it, you're not Superman. But if the resident is light enough and you're able to do it, because they have that ability to stand up, this will work for you. This is an easy transfer. And what you can do, once you get the resident up like this, you can tell them to pivot over to the chair, right? And then you can sit it down. Really, that's the best practice when it comes to transferring the resident from the chair or bed to a chair. The same way you would do the same thing with your resident when you're going from chair to bed, right? Obviously, sometimes you might have to, with the bed, you do have to have that bed a little higher up because you don't want to kind of like, go down slump like this.
The same level.
Yeah. Oh, the same level. Yeah. So when you're doing the resident, and I think like in terms of positioning, now this is the head of the bed right here. If you want to transfer, let's say you want to turn that chair around all the way over here, now you have this resident here. It doesn't really matter. I find it easier for me to do it here from the bed and from the head, right? You're bringing it over here because you're closer. You don't have to pull that resident up. If you're transferring the resident and the wheelchair right here by the feet, you're likely to transfer it kind of like at the bottom.
And they also have the railing too to hang on to.
Yeah.
This way.
Right, you're right. And so when you're doing the transfer from the head over here, you're right. They can also grab onto the railing, but be careful with grabbing onto the resident because they can potentially grab on that like go.
Yeah.
Okay. Yeah. So you want to take this in consideration in terms of transferring resident. And then you have, usually in the bed, you have a chuck, right? You want to put that resident kind of like right in the middle of that chuck, right? If they're low or too high or too low, you can pull that chuck up, not the resident, you can pull the chuck, right? So hopefully you get that kind of picture that I'm creating, is that you're doing the transfer from the chair to the bed, you're putting it in the middle of the chuck, and then if they're not in place, you can pull that chuck further up, further down, or up higher. Remember too, like the bed, if they're too high up and you're by yourself, you can always raise the feet up, and that creates like the resident kind of slide down, and now you can pull that resident up. That helps, yeah. That helps a lot.
That helps a lot, yeah.
If you have a resident that's sliding all the time, you also want to try to keep that feet up. Okay? Especially if you're raising the head up, you want to keep the feet so that way you don't have that slide going on. Okay? Remember, shear, friction, and open areas are related to you pulling the resident. You have a little lady who's 90 years old, it has a really thin skin. If you're doing that pulling, that's shear, right? You're gonna pull that skin off, right? When you're transferring resident, make sure you're pulling it up and going up. Pull the resident up, pull the trucks up, lifting the resident's tissue up, and then bring them up. Otherwise, you're just ripping that skin. But that's how you create those redness and skin tears. Okay? So that's the transfer from that end, from chair to bed, and bed to chair. Let's, does anybody have anything else on how to transfer resident? Obviously, guys, these right here, as I mentioned, you need to start putting this on the resident. Okay, it's a gate belt, it's important. Grabbing onto the gate belt. We can order more. We can talk to Viviana and she can order more. We've ordered quite a bit.
I think she
I don't
has
know.
more though.
Mine keeps on getting stolen. I don't know.
Talk to Viviana, guys. She'll give you one, order one for you. And then we should have more of these somewhere.
Because we used to have them in their rooms, and I don't know what happened to all of them.
They're usually kind of like in the back. I'm not sure, in the drawer or something like that. But we'll order more than like $6 or something like that. We'll get some more in, okay?
Just so they have them in stuff.
Yeah. Right. Okay. So guys, let's go ahead and take a look at these easy stand, right? Does anybody have anything, by the way, they want to share on how to transfer resident? How to transfer resident from that end? Is there any technique that we missed that you guys are willing to share? No? All right. The same thing, guys, with the resident. We're doing a transfer from easy stand, right? You want to get that resident positioned in a nice, even manner, right? They're sitting up straight. Now they're going from a laying position, sitting up, and they're sitting up on the side of their bed right here. Now you're positioning this easy stand, right? This easy stand. We are getting a new easy stand. That's the thing. Here, let me get you guys here real quick. We are getting a new easy stand, guys. So what Raquel's gonna do is gonna go ahead and switch over to the bed here. She's now sitting down in the bed here, okay? So this easy stand is pretty simple to use. The new ones we're gonna get, guys, is gonna have scale, but also it's gonna be rubber right here. Okay, so that's gonna be helpful. We're hopefully gonna get two of them or whatnot. But some of these scales, they do break. The easy stand, they break easily because they're old. Okay, and but they're not cheap to say the least. They're between $5,000 to $6,000. When they do break, they're like $500 to fix them. But we're not in that in-service. We're in this in-service for the transfer, right? There's a remote control here, obviously, that you can use. If that doesn't work, there's an emergency button in here, the red one. Also, there's one in here for emergency. You can stop it if it's going up. You're not able
You
to
pull
stop
it
it.
up or what?
You twist it and then
you
pull up.
twist it.
Yeah, and then you pull up. Okay, you can stop that emergency. Okay, so most important thing with this machine is that you're putting this on correctly. Obviously, this pad right here goes underneath the arm, right? And this little rubber right here, obviously, goes behind her, like this. Yeah. Okay, and then she would put this on, and then it would be connected. Let's just put one on.
Yes.
And then, so just like that, you'll have two in there. The other thing, guys, is we don't miss is this right here goes on the leg. You guys can see this, and then there's another belt here. This would secure the lower part of the body right here, right? The leg, right? We want to put this in, so that way if this resin kind of buckles down, you have this in place here. Apparently this is made out of rubber too, but I guess that's hurting the resin's knee.
It is?
Yeah, this is rubber.
It's hard.
Yeah.
I thought it was plastic this whole time.
So what you want to do with this, guys, is that like you want to have this legs open here, okay? So you'll get access to the whole bed, basically, get it closer to the resident. You want this resident to hold on to the bar, okay? And then there's colors. These slings of color. There's yellow, green, and red, I believe, and they represent small, medium, large for the resident, okay? So make sure we're using the right one, okay? When we are bringing these residents up, you want to have two-person. This is why it's so important when you're doing transfer that you get your residents ready, because when you do transfer, at this point, this is when you should call a CNA to help you or an RNA to help you, because now you can pull these residents up and they can come here and help you now with the transfer.
Okay, but I'm not.
Okay, so
You
yeah.
didn't hook me up.
So she's hooked up. We're pretending like she's hooked up here.
No, you gotta lower it. You're gonna do me on the last one. You didn't even hook me up.
So once you get your resident ready, you got them hooked up, you can call somebody to help you. That's our policy, guys, 2% for transfer. It doesn't mean that you need 2% to get your resident ready, put their shoes on, brush their teeth, all that. That's not what we mean. Two-person transfer, you've already got the resident ready, and you want to transfer to 2%, they're already ready. Okay, hopefully everybody understands that. I know sometimes that can be like twisted, and somehow come on over here and help me, do this
Spot this
resident.
person.
But you can see how efficient this is once you get somebody to help you, right? You bring this resident in here, right? And Raquel obviously does this all the time, but all of a sudden it feels weird, right? That's how does it feel, right? Like, so, okay. So you get your resident, and then you wanna sit her down, and basically your assistants now, right? They're done. Once you get this resident seated down, make sure that the wheelchair is absolutely locked in. This resident is not kind of wobbling around. This will lock it. This is a really old machine, I guess. This is making it squeal. We just fixed it too. Okay, so that's your transfer right there. Your assistant is now done, right? That took like 2 seconds to do that. Not literally, but maybe 10, 15 seconds. You've gotten your policy in place, right, for 2%, right? And then you transfer and you're done, okay? So please make sure you're understanding that. The same process when you're getting resident from the wheelchair to the bed, you're doing the same thing, okay? In terms of transfer. Let's take a look at Hoyer. Okay, the Hoyer. We're not gonna be able to show you the Hoyer because I don't have a bed here, guys. It's basically the same process. Okay, some of these Hoyers do have a weight scale on them. The ones that we're gonna get a new machine, one every year. And with the Hoyer machine, guys, it works the same way. Okay, you want to make sure that your resident is ready. Okay, hooked up in bed, right? This slings right here. This one with porous, it's got holes on it. It's obviously for shower. I think maybe we're right out of slings or whatever. But you want to make sure that these resident is put in the sling correctly. And when you put this in, the most important part is you try to crisscross his sling. Okay, the legs are going to be here and over here. Okay, so, but the most important thing I want to show you guys and I know people are laughing at me right now. I'm not sure if I'm doing this right. I'm pretty sure I am.
You are.
The
You
most,
are.
right?
It's
So,
just think of it as a horseshoe.
yeah. So, you have your resident on a sling right here, right? Right? You already, hopefully you got your assistance. If you don't have an assistance, guys, guess what? If they fall down, you're gonna be in big trouble, okay? So make sure you have 2% assist. At this point, you should have 2% already, right? Okay, so you have it crisscross. Here's the thing: when you're putting a resident from this to the wheelchair, the challenging part is really like what works for me at least is like tipping this chair, right? Does anybody have that? Like use that as like your thing, right? To try to get the resident in place.
Yeah.
You can open the legs of this.
All the way back.
You can open the legs of this, right? Obviously, if it's laying down, you're not gonna be able to get this resident in that chair, right? You're gonna have to have it seated up. This resident is gonna be seated up. And you can drop this resident, not drop literally, but you can put this resident down on a chair. The other way is you can twist it around, right?
Sideways.
Right? You can do this. You can have them twist it around. And what I usually do is I tip this chair like this, and it helps kind of like position the resident, so you're not having to like, once they're in the chair, you're not having to pull them up. You tip this chair like this, the resident is seated correctly. But make sure when you are doing that, you're comfortable doing it, and you're not like, you're like, oh, it's too heavy, and then I drop the chair or whatever. Okay, that's not really recommended. Probably some people on YouTube, they do watch this, they're like, oh no, that's not a really good thing. But you have 2%, as I said, you have 2% doing the transfer, 1% controlling this, and 1% holding down the chair. Okay, so again, the most important part with transfers with Hoyer and Easy Stand, you have 2%. Okay, if you do mess up, you have somebody there to kind of assist you. Okay, with transfer. All right. I don't have a transfer board with me because I think it's in the storage right now. But if I did, hopefully I was able to paint a picture on how to use that transfer board. Is there any other way that we should be talking about in terms of transferring a resident, the safest way? No?
Just to reiterate it, so.
Yeah. So I know sometimes you just like, hey, how do you know, it's difficult to like try to figure out this patient is oriented and he's got a certain way to transfer. You might have to take over and just say, hey, you know what, sir, this is how we're gonna transfer right now, okay? Because I have another help that's coming in. You know, and some of these residents may have their own way of transferring, right?
It's not always safe.
That's not always
Yeah,
safe.
it's not always safe. So just try to convince them to follow through on our policies, so that way you don't get hurt and the patient doesn't get hurt. Okay. Let's go over the test real quick. Any questions or any comments on transfers? Right. So I have it ready to still going. Okay. 20 minutes. Something from transfer. Okay.
Thank you.
All right, guys.
See you tomorrow.
Thank you. Let me know if there's other incidents that you guys want, so we can have incidents on it. Okay.
Good.
He already knows this is